welcome to our next lesson as part of our chapter on anatomy and how anatomy relates to lower back pain. So we've looked already at the basic bones, and now we're going to look at a very common condition here for many people, and it's called the herniated disc. Okay, now it's something we've all heard of, and we're going to also talk about the sister of the herniated disc called the bulging disc. Okay, and these are two very similar conditions that are going to have similar set of environments and even experiences of pain. Okay, well, let me just first explain what a disc is and what we're talking about when we even say the word disc. Now, what we're talking about is an intervertebral disc. Now, what that means is that you have a vertebrae, okay, like what we just discussed in our last lesson, C1 or C2, meaning cervical 1, cervical 2, or in the case of the lower back, more relevant for us, L1, L2, L3, L4. So we have these vertebrae. Those are bones. But in between the vertebrae, we're going to have what are known as discs. Okay, and these are discs that are called intervertebral discs, and their job is essentially to act, amongst other things, as a shock-absorbing entity, a shock-absorbing material, so that as you're walking or as you're running or as you're jumping, your bones don't smash onto each other, and more importantly, don't shake the brain. Okay, so it's all kind of like a shock absorption system that is there as a result of the nature of how we could possibly kind of like shake ourselves as we're walking. So we got these discs, and these discs are kind of like a very thick, spongy material wrapped in a membrane. Now that it's wrapped in a membrane is very important because, the first thing really is, what does the word hernia mean? I'm going to talk about herniated disc now, but let's make sure we understand what the word hernia actually means first, because the word hernia can be used in many contexts, and we're going to talk about it in this disc context, but actually, a hernia means any time something is supposed to be inside of a membrane. It's supposed to be contained inside of a membrane or inside of a sheath, but then that which is supposed to be inside ruptures the outside and sticks out. So if something is supposed to be inside a membrane, maybe fascia or some other tissue, and then that outer membrane breaks and the inside sticks out, that is going to be a hernia. If it's on the inner thigh, it's going to be an inguinal hernia. If it's here in the stomach zone, it's a hiatal hernia. But here in the case of a disc, if the inner disc ruptures its membrane and sticks out, that is going to be called a herniated disc. Now, if the inner disc pushes on the membrane, it pushes, and it actually misshapes the disc itself, so it's pushing, but it's not actually breaking. That's called a bulging disc. Okay, so they're very similar in shape, but the herniated disc will actually have broken through the membrane, whereas the bulging disc will not have broken through the membrane. It will just be pushing it into a different shape. Now, with a herniated disc, it is very possible that you could have a herniated disc and not know it. Now, people think, oh, well, that sounds strange. A herniated disc is such a severe condition. Well, it might be a severe condition, but it's also a very common condition. Okay, and it's said that by the time a regular lifespan occurs, most people, almost 70 to 80% of people have a herniated disc before they die. That's very common, but a lot of people don't know it. Now, the only way you would know that you had your herniated disc, or those people that are experiencing pain from their herniated discs or their bulging discs, is because that herniation, that which is sticking out, is touching a very specific kind of nerve. So, you got your brain, of course, and the brain is sending all these nerves down into the body. Well, there's three kinds of nerves. Okay, well, one kind of nerve is just sending information from the brain to the muscles and to certain voluntary bodies. Those are called motor neurons or motor nerves, and they're, your brain is telling your body to move. That's happening, yeah. Well, another kind of nerve is telling your body if you're experiencing pain. Those are called sensory nerves. That's a different kind of thing. different nerve. So a sensory nerve is telling you that you have pain. A motor nerve is telling your body what to do. And then you have something called autonomic nerves, and that's when your brain is like telling your heart to beat and your liver to do what it does, and all of that, of course, is below your level of consciousness. So check it out. You could have a herniated disc, and it could be impinging a nerve, but if it's not a sensory nerve, you're not going to know it. If it is a sensory nerve, you're going to feel it as pain. Okay, and that's going to go for a bulging disc, which is the same thing. It's just something that has not actually ruptured, or a herniated disc, which means that the outer membrane has ruptured. Now, herniated discs do not heal. They don't heal themselves, okay? Nor do they need to be healed. And in our system, we're not in any way proposing that we're going to heal the herniated disc, because once the membrane is ruptured, it's ruptured. That's fine. What we're going to be doing, of course, is creating an environment where there is no more back pain. Okay? So the herniated disc is an anatomical fact. Okay? And once that membrane has broken, it is now what it is. And so now the question is, how are we going to live a pain-free life? And that's what this system is going to be teaching you. To review, you have the vertebrae, you have the discs in between the vertebrae, and then you have nerves running through your spine. And those are like kind of like the players here when it comes to the herniated disc and what you're experiencing. And so then if the disc ruptures or herniates and comes through and then goes where it wasn't designed to go and touches a nerve, okay, well, as long as it's not touching a sensory nerve, you're never going to know it. But if it is touching a sensory nerve, you're going to know it, and it's going to be painful. But if it's not touching a sensory nerve, you're not going to feel it, but you're still very vulnerable to make it worse, which is why really our system is very, very valuable for not only making pain go away, but preventing pain. Because if you're someone with a herniated disc and you don't know it, but now you start to but you might have back pain or you might not, but you still are unaware, applying this system is going to really make sure that you're going to be staying pain-free. Okay? So that's our lesson on what is a herniated disc, on what is a bulging disc as we relate to the anatomy of lower back pain. We'll be seeing you on the next lesson as we continue to develop your overall knowledge base of anatomy and how it relates to the reasons why you have back pain and the reasons why some of the things that you're doing are not constructive. Okay? See you at the next lesson.